Hello, I'm Dr. Paul Zukov. I'd like to spend a few minutes talking about COVID-19 infections and how our office is adapting. We'll talk about how the virus spreads, what we can do to contain it, and what our office will be doing to keep everyone safe. The COVID-19 infection is caused by a coronavirus, which is typically spread by respiratory droplets. So, if you are nearby to someone who has the infection and they cough or sneeze in your direction, you can easily catch the virus yourself. Recent studies have shown that our respiratory droplets can actually stay in the air around us for up to 8 to 14 minutes just with normal speaking. This doesn't necessarily mean that those droplets are very contagious. More studies are needed to determine this. The highest risk situation is to be within 6 feet of an infected person for more than 10 minutes. This would include any type of public transportation or standing at a bar nearby to others enjoying your favorite beverage. The infection enters our bodies through our respiratory membranes, that is, the mouth, the nose, and the eyes. The virus can live on any surface for some time, though much longer on hard surfaces such as a countertop or something made of metal such as a doorknob. If an infected person touches that surface and then we touch that surface, that is not a problem. The virus on our hand will not harm us. However, if we then touch our face, as we constantly do, then we can become infected. Next, how do we know who is contagious? The short answer is that we do not know. People who obviously have the virus are very contagious. However, someone who is pre-infectious, meaning they are infected but not yet symptomatic, is often very contagious for 2 to 3 days before they become symptomatic. There are probably many people who have the virus and will not have any symptoms, but are contagious to others. So, how do we know who to avoid? It is best to assume that every person you see is contagious and any surface you touch is contaminated with the virus. Okay, so now that we know how the virus is transmitted, how do we protect ourselves? This is obvious, but if you are sick, then stay home. Do not interact with anyone. It would be a good habit to check your temperature each day, and if elevated to more than 99.0 or 99.5, to stay home. Hopefully, all of us are aware of socially distancing. Staying 6 feet away from a contagious person will significantly reduce the odds of contracting the virus. Wearing masks is very important if you are nearby to others, especially if you are closer to 6 feet. It is important to know that if you are close by to me, when I am wearing a standard surgical or cloth mask, that mask will protect you from getting infected by me if I am contagious, but that mask will not protect me. I am protected when you are wearing a mask. Washing hands or using an alcohol-based sanitizing lotion is very important immediately when you return home if you have touched anything such as a doorknob. Again, do your best not to touch your face. So now that we know how the virus is transmitted and how to prevent its spread, let's discuss what we're doing in the office. Things will be very different for all of us in the office and for our patients, but what will remain the same is high quality, comprehensive, compassionate care. For the foreseeable future, we will not be using the waiting room. We will have virtual check-in, remote pre-visit planning, and virtual check-out. A few days before your appointment, expect a call from one of our receptionists. They will make sure that your insurance is up to date and that we have your current phone number, address, etc. Also, a few days before the visit, you will get a call from our clinical staff. They will make sure that your list of medications is up to date, see if you need any refills, see if you are due for any routine testing such as mammograms, and ask if you have been to any other doctors recently. This will reduce the time they would normally need to spend with you in the exam room. When you get to the office for your visit, we will ask you to call us from your car. Once we are ready for you, one of our clinical staff will meet you at the front door to the office, check your temperature, and make sure that you have a mask. They will then bring you to the exam room and measure your blood pressure and pulse and make sure that you are prepared for the visit. Please let us know if you do not have a cell phone so we can make alternate plans. You will be seen then by the doctor or Carol, our nurse practitioner, or Samantha, our physician assistant. In the usual way, again, all of us will be wearing masks. This virus will be with us for quite some time, so we need to adapt so that we can live our lives and continue to get proper medical care and attention when needed. We look forward to seeing you again, and we look forward to all staying safe and healthy. Of course, call us with any questions. Thank you.